Thera-Tabs M is a multivitamin and iron product that is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help maintain good health. It is recommended to take 1 tablet daily, preferably with a meal, to ensure optimal absorption. Taking Thera-Tabs M at the same time each day can help you remember to take it consistently. When taking Thera-Tabs M, it is best to take it by mouth, usually once daily or as directed by your doctor. It is important to follow all the directions on the product package and not to exceed the recommended dosage. It is best taken on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water. If you experience stomach upset, you may take it with food. It is important to avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. It is also recommended not to lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed release form or extended release capsules, swallow them whole and do not crush or chew them. It is important to take this medication regularly at the same time each day to get the most benefit from it. If you experience constipation, diarrhea, or upset stomach while taking Thera-Tabs M, these effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, contact your doctor or pharmacist. Iron in Thera-Tabs M may cause your stools to turn black, which is a harmless effect. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential side effects. Many people using Thera-Tabs M do not experience serious side effects. While rare, a serious allergic reaction to this medication can occur. Seek medical help immediately if you notice symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice any other effects not mentioned, contact your doctor or pharmacist. For medical advice about side effects, contact your doctor. In the U.S., you can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It is important to keep Thera-Tabs M out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If an overdose does occur, it is important to seek medical help right away or call a poison control center. Thera-Tabs M is a supplement that can be taken to help ensure that you are getting the iron and other essential vitamins and minerals that your body needs. It is typically taken once daily, and it is best to take it with food to help with absorption. Be sure to follow the dosage instructions provided on the label or by your healthcare provider. Before taking Thera-Tabs M, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients or any other allergies. This product may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more information. It's also important to inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin brand contains folic acid, be sure to tell your doctor or pharmacist if you have vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia. Untreated vitamin B12 deficiency may result in serious nerve problems, so it's important to consult your doctor or pharmacist for more details. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. Remember, Thera-Tabs M can interact with other medications, potentially affecting how they work. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication without consulting your doctor first. Thera-Tabs M can decrease the absorption of other drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as much as possible from your doses of Thera-Tabs M. Ask your doctor or pharmacist for guidance on how long you should wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin also contains folic acid, let your doctor or pharmacist know if you take certain anti-seizure drugs, as they may interact with Thera-Tabs M. Also, keep in mind that Thera-Tabs M may interfere with certain lab tests, potentially causing false results. Make sure that all lab personnel and your doctors are aware that you are using this medication. If you or someone you know has taken too much Thera-Tabs M and are experiencing serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents should call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Always take the recommended dosage of Thera-Tabs M and seek medical help if you suspect an overdose. Remember, it's always better to be safe than sorry. If your doctor has prescribed Thera-Tabs M, it's important not to share it with others. Make sure to keep all medical and lab appointments as recommended. Some brands of Thera-Tabs M may also contain ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to note that Thera-Tabs M is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you are taking Thera-Tabs M on a prescribed schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time of your next dose, it is best to skip the missed dose and take your next dose at the regular time. It is important not to double the dose to make up for the missed one. Thera-Tabs M should be taken as directed by your healthcare provider to ensure optimal effectiveness. It's important to store Thera-Tabs M at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When you no longer need the product or it's past its expiration date, it's important to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on the best way to do so. Avoid flushing the medication down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.